going to do a lesson on the corona, C-R-O-N-O-V-I-R-U-S, the coronavirus. The
Coronavirus.
Yes, the coronavirus is something.
I want you to smush out the meat so it goes there.
Don't hurt by scissors.
Hold this.
Scissors are dangerous.
Pay attention. Hold this up here. And mush the meat out, okay? You're gonna have to squeeze it. Yeah, squeeze it out.
You can do it.
Okay, go for it.
So our son has autism, and he also has very severe cognitive disability, which also means he has a language disorder, and it's very difficult to functionally communicate with him. Financially, it's really puts a big burden when you have a child with special needs, just for many reasons. Our son also has a lot of medical needs, so you have to work. But at the same time, you have so much at home, and literally you can't fit all that in. And there really isn't a structure for that. Everybody's in this free fall that could become very dire as it goes on. All right, so here we're going on our daily walk down to the river. Hey Jay, what are we doing? Yeah, dude. We're trying to get more of a kind of schedule going where we have lunch together, we go outside and walk. We socially distance, we live right by a park. My husband and I are educators, but we are not special needs educators, and so we're just kind of randomly doing our lessons with him and trying our best. But he's made a lot of progress at school because of the dedication and the skills of his specialized teachers and therapists. So with this kind of time off, what's gonna happen?
You know, a good way to think about it is like typical parents with typical kids are freaking out having their kids at home trying to, do the general ed curriculum. And special needs parents, they are trying to do the job of 6 people. And so anything that's hard for a typical family is always 100 times harder for families that have special needs. We work really hard to make sure that our students with disabilities have consistent services throughout the school year. So most of our students receive ESY, which is called Extended School Year Services, which mandates that they go to school through the summer because routine is so important for them, and we work really hard to get a consistent routine for them. And so a disruption like this is just detrimental to their progress, to their families.
We have what's called a social story to explain that people are sick and we can't go out. We kind of thought he kind of understood why he wasn't going to school, but even that night before, on Sunday, before the routine really changed, he was kind of saying, want to go to school, want to do this, and we're kind of explaining, and then he did something he has not done in a while. Is he wet the bed very extravagantly through 5 layers plus a mattress protector. And so we're just realizing, even though he's not talking about it, he's clearly having trouble with this new change. So we're kind of all at home trying to work this all out, and we don't have tons of household help. It's not like because our son has special needs, we have aides and nurses everywhere. It's us, pretty much.
Here, turn off the lights so it looks like.
Ah, let's see. Oh, what do you think, Jason? Where else did you see a lamp like